Okay, I'm gonna call this meeting. Is that a yes? Can you hear me? Yeah, okay. Uh, all right. Thank you everyone for coming. Welcome. Kathy is representing OHA today. Um, I just want to thank everyone for last week's meeting. I know we were mostly in agreement last week, so the meeting did go very smoothly. It does show us what we can accomplish when we do work together and we are open and listening. And so I hope that we will continue in that strain and just be open and listen to each other and uh, be willing to collaborate. Today I we are going to be talking about the recommendations. We don't have on the agenda that we're going to go over the NSM's data, but I think that we should be doing that as well. Um, okay, but I'm going to hand it over to my chair, and then we'll figure this out. All right, thank you.
Thanks, Maureen. Oh, yeah, I echo her comments. I think we both agreed that last week's meeting was very productive. We were able to move several things forward, and we just continue to hope we hope to continue in that fashion. Moving forward here, not just for the purposes of the upcoming report, but additionally, as we continue to work together in the future. We will be, as we discussed last week, we will be asking for an extension to submit the report as of January 10th, to buy us a little bit more time to finalize our discussions and finalize all of the recommendations, and also to give us more time to write the report, et cetera, and have one or two additional meetings as necessary given the holidays, et cetera. But that is the plan at this time. I do see Mr. Morgana has his hand up, so Mr. Morgana.
Yes, I was looking at the agenda and it says review recommendations from consumer advocates, but it doesn't clarify whether or not is voting including in the word review. Are we vote? Is that understood as part of the agenda, or do I need to add that to the agenda?
A motion would need to be made. I mean, at this point, I can certainly speak on behalf of the state agencies that if there's going to be any revisions based on discussions today, certainly the state agencies would not be prepared to vote today. So I would suggest calling for a meeting towards the end of the year with respect to that, because all of the recommendations need to go through proper channels at a minimum, which does take some time. And until we have a finalized set of recommendations that we wouldn't have necessarily until after today, the state agencies would have not had the appropriate time to do that. Mr. Tappan, I do see you have your hand up.
Yeah, in response to what you just said, the final version has been sent around. There's not the advocates anyway behind their recommendations, which is on the agenda for today, don't have any further changes to them. So everybody's had them. Also, I don't understand what you say, according to the state, you're not here for the state agencies. You're supposed to be co-chair. So when you say the state agencies, like that's not your role. I don't see that. If state agencies want to speak up and say, hey, I need more time or something, they can do that. But I'm troubled by your suggestion that you're here representing all of the state agencies.
I didn't suggest that I was, but I am suggesting that on behalf of the state agency that I'm here for, that we would not be ready to vote at this time. That we need to go through proper channels.
Okay, just one agency. In any event, you've had plenty. Everybody has had for several days now, so there is time. So I don't see any reason for delay. That just seems to me to bring more delay that we just don't need given the time press. And even with I understand you're asking for a 2-week extension, which seems appropriate. There's no reason not to go forward with voting.
I'm just saying, in fairness, Mr. Taubman, based on today's discussion, there could be revisions that need to be made to the recommendations. And I'm saying to allow time for that, That's all I was trying to suggest, is that we are having a discussion on these recommendations today. There may be, based on that discussion, we've not had it yet. There may be need for further revisions. And I wanted to be fair to everyone across the board to allow time for that to happen and to allow those, again, the recommendations to go through proper channels.
Okay, so
That's
then in light of that, then the better approach is to just go forward and see if there's, I mean, we already had the discussion. That's why I'm confused, because we already had the discussion last time and you gave people 2 questions on every single issue and they asked their questions and nobody had any other questions. But I'm fine with going forward with further discussion. It's just that from what you're saying, as long as there's no changes to it, we can vote on it now because the state agencies have, including yours, have all had several days now to look at it and they can vote on it today. If there's no changes, I mean.
If a motion is made and passed to take votes, then obviously we would move forward with taking votes on these recommendations. But then we would then need an additional meeting to do the same thing with the industry recommendations.
So Jonathan, to be clear, do I need to make a motion to change the agenda, or is it understood that after the conversation that a voting can take place? Yes or no?
Once we go through the discussion, if someone wants to make a motion to vote, then they can make the motion at that time.
Okay.
Okay, so do we have any discussion on any of the revisions or recommendations by the advocates?
I do want some clarification, please, because this is the concern I had before. I would like it to be very, very clear on the agendas and to this point. So like we're having conversations, we had feedback from the previous thing for the advocates, and now you have this clean copy that came up. We had things that were shared. We had 2 questions that came up. There's feedback to the point you brought up, Sheldon and David, and now you're saying vote. And I'm a little confused here. And as the concerns I brought up before, no matter what, the advocate votes is going to outrule everything. We already know that because that was shared in the last time. So my question is, if there is, I thought once we go through all the things that the advocates put up there for recommendations, the industry puts up there for recommendations, we have a discussion, we give feedback on what was shared of concerns on both sides goes into that report. I thought that was going to be shared. Now, what am I misunderstanding here? And I think that's why I'm at a loss.
So, Ms. Rascott, let me clarify one thing, that regardless of whether or not a vote is taken on the recommendations, and again, that motion was made and passed a couple of weeks ago. So I do want to acknowledge that. The intent was always to put forth a form with a list of all of the finalized recommendations. And that is still the intent, Maureen's and my intent, is to put out a form that everyone has the opportunity to comment on whether or not they are in support of or not support of the specific recommendations. There will be an opportunity to comment on that. The intention is to have that form, if we get everything finalized today, as far as the recommendations go, the intent is that form will be out no later than Thursday, with everyone having time to comment by the 20th. Understanding, again, some people may take vacation, people might be away, so they may need to comment after the 20th. But the intent is to collect that information so that is part of the report, so that people's comments specifically on the recommendations will be part of that report. That was always the intent. Mr. Tapman.
Yes, I agree that was always the intent, and I think that resolves it. The only thing additional, Diane, is that we need to vote on the recommendations so that people know what to comment on. If a recommendation doesn't have a majority, it's going to go away, and there's no reason to comment on it. So we kind of need to, I think, have that first before people are doing the survey.
If I can just step in here, Mr. Taubman, I think Ms. Rascott's point, though, is that given the nature of the makeup of this group, that the advocates have the majority, and given the advocates' recommendations, which the advocates all agree on, and Ms. Rascott's recommendations that she presented last week that everyone agreed on, as she pointed out, and the recommendations regarding the clarifying language that Maureen and I presented a few weeks ago, there isn't anything that's not going to move forward, is her point, based on a majority vote. That's what she was asking for clarification on. Ms. Rascott, am I speaking out of turn for you, or is that
No, you're not. I mean, and that's the point. I mean,
that's what she's asking for clarification on, Mr. Taubman.
The only thing is that we did vote 2 weeks ago, I think it was, that we're going to vote on each individual recommendation. That was the motion and it carried. So we're going to do that. And all I'm saying is let's do that now. I understand your point that people may have comments, suggestions, and it's possible that the advocates would agree with it. And just like we gave comments to Diane last time, some of us, about her recommendations, which we supported in general, but we had suggestions for revisions, which she seemed to reject. I'm not sure why, because they were friendly recommendations, making the recommendation more palatable, perhaps, and also reflecting what's happening maybe in other states. But I understand your point that if there's going to be revisions, then things are different. But if the proponents of the recommendation are fine with it as is and are not willing to make any changes to it based upon the discussion, there's no reason not to go forward with it.
I'm not going to say, put words in my mouth, Sheldon, on it. I'm not going to get contentious here. It's a discussion, right? It's a dialogue being able to have with the right people on this for why we need to change certain things or how to change certain things to the legislator, right? It's not a matter of, because we are not the ones that have the ability to make those changes and what those changes are going to be from the insurance side of it, the funding side of it for the legislators to approve it. There's a lot more to it than what's just being stated in the recommendations. There's a lot that goes behind the scenes, right? So you need to have the dialogue with the powers that be that these changes and recommendations are going to affect. And that's the people that are not in this room that these changes and recommendations are going to be imposed upon. So that's why I'm kind of saying I'm not being reluctant. It's not that we're trying to be saying no blatantly. Is there's more to it than that. It's not as simple as black and white language that's being proposed. So that's why I want to make sure it's like you have a conversation, but there's more to it that needs to be involved. Because even those recommendations, it's not even fully, like we said, like the comments I made last week, there's some things that are out of the state's control. They don't have control over it, but we hope the legislators would have a conversation and have those things to carry forward to. There's some things that you're going to try to legislate that there's some things that they can't do, or if they do, there's certain things that got to be discussed and how that looks being proposed. So that's the conversation. The next steps for those, what would that be?
You're on mute, Maureen.
Diane, you had said last week that you did not anticipate making any revisions to your recommendations. Is that still correct?
Not necessarily. Yeah, I don't think so. I think there was just some feedback we wanted to get from the notes on that. And if there's something that we think we need to adjust, what would it be like to the reporting format of those revisions or whatever it may be? We gave some feedback onto the report and how that would be. Does it need to be legislative? No, it doesn't need to be legislative. I don't want to make things that, well, because once you go down the legislative road, you're done, right? And there's no room for adjustments, right? So I just want to make sure when we're looking at some of those things, how do we do that? You got to leave room for discussion. You need to be room for how could that possibly work? And sometimes that's why I think committees are better than trying to legislate something. And if it doesn't go the way you want, then it keeps going, and then those are next steps. But if it's not showing progress, let's go look at it. And then that's why I wanted to make sure it's a conversation. What do we need to adjust? What can we talk about? What things do we want to add as a final, feedback on? And that's why I was hoping when we did this, that the advocates would put in their feedback, we put our feedback in there, get the report. And then if we need to have the committee comes in for any changes, here's why, and let's talk about it and then go from there. But again, I'm one person here speaking.
Mr. Short.
Yeah, so we know that we all agree on the industry's recommendations. We don't know what you guys disagree on with our recommendations. So can we go over them and at least know which ones we're all on par with? And then which ones we might need, other powers to be in order to be able to make into legislation, so we get the ones that we're at least all in agreement on, so we could move forward with this rather than having a power struggle.
Thank you. Do we have any comments on that?
Yeah, a couple of people have their hands up.
Oh, I don't see them. Hold on. Sorry. Oh, Jenny.
Yes, we just want to make sure that the Department of Social Services has an opportunity to also weigh in on those recommendations. We haven't had a chance to do so.
Ms. Mahoney, are you prepared to weigh in today?
No, I would have to
You
bring
want to
it
take,
back.
you want to
Yes,
take it
yes.
back. I'm sorry, who else had their hand up? Sheldon.
Well, this will go on forever. Basically, as Jonathan laid out, DSS and other agencies will have the opportunity to submit any comments they want in response to any of the recommendations. But we did have the opportunity last week for any questions, 2 questions per recommendation from anybody, including you, Ginny, and you're just being offered the opportunity to ask more questions today or whatever, make comments. So like, if you're not prepared, we really have to move forward. I think we need to do the voting after discussion, unless the advocates agree to any changes. And then DSS, as with all other parties, can submit their comments in response to the voted on recommendations.
I think in Jenny's defense though, Sheldon, you guys directed all those questions to me when I answered to those specific things though, in that meeting though.
You mean your recommendations? Oh, Jenny, were you commenting about the industry's recommendations or the advocates' recommendations?
Both.
Both, because during the advocates, the first time I waited to the end of the session because Jonathan and Maureen and some other answers, and I held my questions to the very end because it was really directed more so, and I was able to answer back to all your recommendations that you guys had and ask for clarifications, and my concerns were those, and those are on record. So, I can go through them again if we guys need to, but I thought those were captured, but maybe not.
Mr. Root.
I just seem a little confused right now. I do feel we reviewed a lot of these recommendations last week. There were a few points that, I did discuss, as well as with DSS, and we talked about transportation. That was all discussed too as well. We had, what was it, a week or so to prepare. I'm just, a little concerned because if we keep doing this, we're just going to keep delaying it. Nothing's going to get addressed. And I do think we need to, as Mr. Short says, and the advocates, that we just need to kind of work productively here because we could drag this thing out a lot longer than it needs to be.
Thank you. Mr. Morgana.
Yeah, I agree with what Daryl just said. I was just curious, DSS just said that they needed time to go over. How much time are we going to spend going over this, and how much time were they asking for to go over this? Because again, I'm concerned about the timeline and getting things moving forward as well. So are we talking like weeks? Are we talking Like, what are we talking here?
Well, before I can respond to the comments, someone always has to review them because the response is on behalf of the department. Being that there's a lot of stuff going on our plate, it's gonna take probably a few weeks.
So are we suggesting, based on that, that we have to delay voting for several weeks? Am I understanding that correctly? That's what you're asking for?
If I, if you guys want to vote today or whatever, and then our comments can be submitted, then, you know, it's whatever the majority votes for.
Sarah?
Thank you. I just wanted to sort of chime in, uh, confirm and affirm what some of my colleagues, comrades have said, but also just to speak up a bit and say it's important that everybody does have a voice here and is able to be heard. Of course, that is why we're here. I think like most people, I'm a bit concerned and alarmed to hear that, you know, several weeks into this, into reviewing these recommendations and whatnot, that DSS feels that they have not had an opportunity to voice, their opinions and whatnot. And it's nice to hear from Ms. Mahoney why that is, you know, getting back. And I appreciate that David got to that question before I did. But that is, of course, a problem now, but I could see that also being an issue moving forward. If there's a way that we can just streamline things or make it easier, I would love to know what we can do, if anything, to help with that, because we need your voice, but also it's not your fault, but the back and forth on reviewing recommendations and going back and adjusting them and sending them out and then not, you know, having to review them again and then waiting weeks. And it is feeling extremely disrespectful to the time of all the people here. Not just myself, but everybody here, folks that have very busy lives. So if there's some way that we can be more streamlined and a bit more professional about this all the way around, please do let us know what we can do, because that would be fantastic. Yeah, let us know how we can help. Thanks.
Thank you, Farah. Actually, that's a good, I understand that the members, at least the members of the state agencies and the industry were not prepared to vote today, and that does put them at a disadvantage. I'm just wondering, we did do a doodle poll about meeting next week, and I'm just wondering what if we hold out on the voting until next week and we can meet and just do the roll. I understand roll call vote for I don't know, Chandra, how many recommendations we have total, but it's quite a few, and I believe that is a little bit timely. I don't know if she can weigh in on that, but maybe that's an option that we can think about, is that maybe but a week be enough to give you time to talk to your people and decide at least how to vote on the recommendations. That would also give time, if anyone has any, for us today to do any tweaks or any changes to the recommendation.
And we would still do the forum in addition to that, so that everyone has time to provide their comments. That would still happen, just to be clear.
Mr. Tapman?
When is the meeting scheduled for next week?
We didn't schedule, I don't think we scheduled it, but
If we're not scheduled for next week, then I don't think we should wait for voting. I mean, if I could see waiting a week, but again, Ginny's concern will have to be addressed in her comments. DSS or any other agencies will have to address it. I mean, you're asking for a 2-week extension, which would still make the report due January 15th, and you can't, or whatever, and you can't get comments from DSS on January 14th. And then, I mean, you're going to need, so weeks doesn't work. I mean, maybe a couple weeks, but in any event, it just seems that we're setting things up for delay if we don't actually vote on both the industry's recommendations and the advocates' recommendations. We really need to get that out of the way, and then everybody can comment on those voted on majority recommendations.
thank you. Okay, so I'm gonna ask the other members of the council, if we did have a meeting next week, would that be helpful for voting? Or if it does it not make a difference?
I'm sorry, Maureen, I've had my hand up for a while and I would like to interject before. I don't know if you guys can't see it and I know I keep getting bypassed here.
I'm so sorry. You're right in front of me and I don't see your hand, so I'm sorry. Go
That's
ahead,
The hands aren't
please.
showing, by the way, on the screen. I didn't see it either.
Yeah, it must be blending in. So a couple of recommendations, and I think this is part of the frustration and maybe some of the confusion for the group and that. So we need to make sure on our agendas are very clear what the intent is, like for the voting, and that should have been on the agenda. If the intent is for feedback on the thing. So today, like I thought the agenda was going back over and then finalizing the feedback for what you guys finalized for the advocacy group, right? So your recommendations, here's what we're going to review, any final comments that were in, any agenda notes that were going to be in it. That's what I thought I was going to see today. Like my feedback was going to be in that. It wasn't in there. So that was a little bit of confusion for myself. I thought maybe if we put the industry, what your guys' feedback was going to be in the notes from that. So that wasn't in today's meeting. So I think part of the things for the delay might be contributing to this too, for the points for the industry, for the DSS and the other advocacy groups, other industry groups too, to look at. So I think my request, maybe if I can ask for, is if we can put Jonathan, Maureen, that we put the notes that Chandra has from both the advocates and the industry's notes and the things that came up that were voiced. I think we have the notes from both that was shared of concerns from the previous note taking, that we have that shared for the group. So people have this time between now and next week to review it, whether it's, the formal meeting notes or whatever, because I know that wasn't rolled out yet. And I think that might have helped people to be able to, because I wouldn't have been able to vote today either without looking at those previous meeting notes, right? And then have for questions for clarification on something. And then if that was the intent, because that was like, I was confused, like I didn't know we were doing recommendations before the meeting when I spoke to you and Jonathan, like, hey, I didn't know we're supposed to give recommendations already when the advocacy group came up with theirs beforehand meetings. I think we need to have a little bit more directionality with this, to the point, so everyone doesn't think they're spinning their wheels. And I think I would like to have that. So next week when we do meet, we're very directional. And then that way, when we do vote, even though I had my opinion, votes moot because we already know where the votes are going to go, just by default of the group. Then that way we can do the summary report. And that way we can give it back to the legislative group. I think that needs to be very clear. And I don't know if we need to make a motion for that. I don't know feedback from the rest of the group, but I think that might help. Then that way I could give notes ahead of time, or if I need to send something ahead of time for clarification before the meeting, so you guys could put that out for the group in a timely manner. If I have to put notes back to you by Friday afternoon for next week or Monday morning, we have that time to do it accordingly for everybody to review.
Thank you, Mr. Slifka.
I agree with Ms. Rascott's comments, and I think to also to piggyback on what Ms. Mahoney said earlier, it seems backwards to me to vote on recommendations before we've had the time to comment on them. So the intent of the form and again, still the intent of the forum is to have all of the agreed on recommendations put forward for everyone to comment on. And then from there, you can proceed to a vote. That seems to be a more forward way to do this. And also, you know, again, the forum allows everyone to provide context. To the question raised earlier, is a week enough time? You know, I can't say that a week is necessarily enough time. It's better than nothing. But you know, you know, I can't say for certain. And you know, that's and also, you know, to Ms. Rascott's point, neither Maureen and I were prepared to take votes today. The staff is not prepared to take a vote, a roll call today on votes. This was not, in fairness, proposed as an agenda item for today. So I am troubled with the idea of it being done today, given the lack of preparation for it on behalf of a significant number of the council members. So thanks, Maureen. I'll stop there.
Okay. Mr. Morgana.
All right, we're 38 minutes in. For the purposes of moving forward, are people prepared to do what we need to do next week? I think it's, if we're gonna have a meeting next week, can the state get things in line so that they feel okay about voting on stuff? Because I don't want to spend any more time on this. We're 38 minutes into this. We don't have time to be playing games, talking for 40 minutes about this. Come on. We need to start talking about the actual stuff. So can we all agree we can vote on this next week?
Sheldon.
Yeah, I'm following that. I'm moving that I have a motion that we will have voting next week on all recommendations. We can discuss whatever we want, and I agree, we've already burned up 38 minutes unnecessarily. We can discuss it some more today, plus we'll have the minutes from the last meetings, but this is it. And if an agency such as DSS cannot vote by next week, they can always abstain, and they will be able to submit their comments and response. But I move that we agree today that we're going to vote on all recommendations at the meeting next week. If it is next Tuesday, 11 to 1, I assume.
Okay, do we have a second?
I second that motion to vote next week.
Do we have any further discussion? I know we've eaten up a lot of time, but does anyone have any further discussion on this? Okay, and if you have your hand up and I can't see you, just shout out.
This is Farah. I don't have my hand up, but I figured I would just skip the step. Sorry. I would also, seconding or thirding, but I also would just like to also support what Diane had said a little bit earlier about having some clarity in our agenda, just so that we are certainly all on the same page. I think that would be very good and helpful. But with that in mind, I think, and this is, I think, no fault of anybody's, but I think that does mean very good, clear, accurate reflecting of the decisions and votes and whatnot that are happening in our meetings today. Fortunately, we have someone who's very good at that. Thank you, Chandra. But I do think that is helpful, having a clear plan for what to expect at our meetings. So I do agree with Sheldon and Daryl, and also I think that Diane is spot on, that is helpful when knowing what to expect. So that's my 2 cents plus some sense, as always.
Okay, thank you. Anyone else?
We're all set.
So Maureen, will we be able then, Maureen and John, to have the notes then from the last 2 sessions with the feedback? will Chandra have that to send to all of us? So when we do meet next, we'll have all that information.
I believe so, Chandra.
Yeah, I don't think either one of us wants to speak for her, so.
Yeah, that's why
we-
I'm asking. I don't know if Chandra can answer
we
for
would-
us.
We would defer.
Do our best. And with the holiday, I have an intern who's been remarkable helping me out with them. So
Okay.
we will try. Thank you.
Yeah, if we can, or at least a hard notes, cliff notes or whatever the best between the two sessions for the feedback for both meetings. I think that's what we just need. I'm not going to speak for the whole group, but I'm sure if we get the gist in those, I think that's what we need. So when we all meet next week, if there does need to be clarification for that, I would ask the group and maybe ask for a motion on this, that we send ahead of time when we read these before the day before the meeting, that we're going to ask for clarification at the start of the meeting before votes for anything that we want clarification of, whether I have clarification from the advocate side, whether advocates have clarification from the industry recommendation side before voting occurs, and we log that and then vote. Can we have it in that format? Can I have anybody motion or second that or agree to that? So we're very clear for next week's meeting. Jeannie. Okay. Because I think that's very, very important that we're all on the same page and very clear, and it seems like no one's missing. Okay.
Hi, this is Sarah, the intern that's been doing the minutes. I will get them to you by Friday. I'm in the middle of finals right now, so that's why they've been a little bit delayed. But yes, I will get them to everybody with detail by Friday.
Thank you, Sarah, and good luck.
Yeah, thank you, Sarah. Agreed. Good luck.
Do we need, Jonathan and Maureen, do we need to change the date then for the meeting if it's Tuesdays too soon? I mean, if Tuesday's too soon for, I don't know what the people's schedules are like next week, but
You want to send out a doodle poll?
I mean, I know I got Wednesday open if we need to a day, or I don't know, people, I know schedules are hard for people. I know sometimes Zoom might be better for people's schedules versus in person, but I just want to be respectful and give everybody time that they need to for this, but also not delay.
I think we can send that a doodle poll. And we'd set the doodle poll up for Tuesday on to give everybody a minimum of a week.
Anything else? Okay, so I'll move for a vote. All in favor for moving the voting to next week. Say aye.
Hi.
Aye.
Yep.
Aye.
Opposed? Abstention?
Of course, at the insurance department, I'm gonna abstain.
Okay, thank you.
Thank you.
Looks like the ayes have it. This motion passes. Okay, so moving back, do we have further discussion on the recommendations by the advocates? Okay, and I don't think we have anything for, it's not on the agenda. We don't have any further discussion for the recommendations by the industry. Would that be correct? Okay, and I'm not sure, oh, sorry, Sheldon.
Yeah, I just wanted to clarify that Diane was saying, well, they have to go back to other people, there's other interested parties and stuff. Our recommendations last time were to just make them um, more reasonable. So that there's less burdensome. That was the idea. So as an example, I mean, this is a very small thing, but last week we had suggested that when you talk about payers should cover annual preventive maintenance of all CRT wheelchairs, we just added in, we suggested adding in per the manufacturer's recommendation. Like that seems so non-controversial, but also makes it more reasonable. So I mean, that was sort of, that's why we
Yeah,
proposed it.
Sheldon, and when I get those notes back, I will make those adjustments like you have on here. And like, I need to see those notes. And that's why I didn't, like today, I thought for your recommendations that came back, I was hoping to see the notes that I have. Because most of the recommendations you guys have in legislative, I'm not going to agree to, right? I don't want to legislate any of those things. And I said that in my notes. And I'm not going to agree to anything being legislated. I'm not going to take punitive language. I'm not going to agree to all, the weekends and holidays being added on to that and overtime. Now I got to add all that stuff. I'm not going to agree to a lot of those things that you guys are putting in your recommendations. And I'm just going to have to write to that. There's many and many reasons why for that. There's multiple things. And again, for expediting shipping and all that, I still have to get cost factors. I'm trying to pull all that information together and stuff. So you guys have things on here that you wanted to vote on in the legislative section. I'm going to have to say no to everything on it because I'm still getting data on it. So like I can't comment per se on it. I'm going to put in writing to the comments when we get ready to that point. And that's why I'm waiting for those notes to kind of put comments back to and make the comment and the report, the formal report when it comes back. Just like I expect you guys to go and do the formal report back for manufacturing, what have you, right? Because that's the purpose of this, to have the right to do your free form flawed on this.
I was commenting about your recommendations, not ours, and
Yeah.
they were just some thoughts. But just so I understand, are you saying that? I mean, I understood 1 through 4 and 6 of your recommendations. They all use the word requirement. You're saying you don't want that as legislation? Because they're never going to happen if it's not required, because most of it applies to payers, DSS or private insurers.
If we wanted to get I mean, that's at the conversation. Do I want it legislated? Maybe. Maybe it's a conversation. Do we want to legislate? It's a hard thing to get to because we're talking about finances, right? I'm going to have a conversation around it. And some things that we want to legislate these things. Would I love to have preventive maintenance covered? Yeah, it makes sense. It's a policy change. Do I want to have these things? Yes, I do want to have this coverage. Should we have paratransit for clients to be able to get some help? Yeah, we should. Am I going to legislate it, mandate it? This is, again, some things that are hard to mandate. I'm going to have a conversation around it. Enforcing these things is not always a good thing to do. I would love it. Yes. But I am not going to hard nose. I want a conversation around it. Can we feasibly do it? Is it possible? I don't want to be adversarial. I would love it to have it happen.
I mean, just as an example, on prior authorization, we legislated it because we knew it wouldn't otherwise happen. And then it worked, right? Or will work come January for the commercial insurers. I mean, this is your recommendation. I'm
Well,
not
commercial insurers is only doing it for the ones you have. It's not working for working for their RISA. We're still dealing with that. Yeah.
And what that confirms is that things only change when you legislate it.
Yeah.
I'm just saying, but it's your recommendation, so I'm not.
Well, I mean, and again, this is Sheldon, it's a conversation. If we as a group want to go and say we want to legislate this and make those recommendations, we will. But I'm not going to force something to the group. It's a conversation. Do you understand what I'm saying? If the group, as a group, we say yes, let's make this a legislative language, then we will. I am not going to go to you and say, advocates, I'm going to mandate this to you.
The problem is that's fine, but we have to vote next time. So I'm not going to propose any further changes. I'm going to just say, if we're going to go with what you said, we'll vote on it. Okay.
Yep.
Thank you.
Yep.
Mr. Root.
Yes, I'm pretty sure that we reviewed some of these recommendations too from the industry last week, and it seemed as though we were mostly on board with them. So I do think we need to make legislation. We need to like put our foot down, and things need, if we want change, we need to put our foot down, and we need to get these things dialed in for the industry as well. As the advocates' perspective, working on both sides, both as an occupational therapist and ATP, as well as being in a chair for over 20 years, there needs to be accountability on both ends, and I think that's where we just need support, and if we're just going to keep kind of wishy-washy in this and keeping gray areas, there's not going to be accountability.
And I agree, Daryl. And again, this is the point of what I was saying earlier in the sessions, is a dialogue, right? We're going to be opinions. It's a matter of when we go and bring this back to our legislative committees and speak with our congressmen and senators, and where do we need to go to? We also have to work with DSS. We also have to work with the insurance councils. We also have to work with our private insurers. And there's ways and things that got to be done. And what is that going to take? And I've usually have found over time, speaking to the different things and what it's going to take, the impact is it works better when you have a conversation around it and make proposals. And then if you do get to the point where you can't get in when you mandate, then that's the language we'll put in and make those recommendations around that. But again, I've been at this gamut, not as long as Sheldon has, but in the insurance world that I work in day in and day out, it works better when you have conversations first and then make the proposal and explain the why, right? Explain the why behind it. And that's where I'm speaking to from the industry side. When we say these things, I don't want anybody thinking that we're just trying to, let's face it, everyone just thinks you're just out for more money, but there's challenges, right? We're trying to think about the whole big picture and why we got to the point where we're at. And that's why you see the recommendations that we throw out there, and what we talked about during the task force and that. So, and that's the stance I'm going to take from at this point. And I'm speaking from myself, from our company, and then I'm pretty sure Gary and the rest of the CRT industry would probably be saying the same thing.
Thank you. And yeah, I agree with the why, and I think the reason why we are very frustrated over this is because there hasn't been change. There hasn't been systematic, instructions and accountability, and that's why we're really pushing for this. So that's my why, and I believe the advocates, feel strongly too as well.
And I think to the point, and I think Jonathan and Maureen, I think when we get to the final end of the final draft or report, the type of language you put in, Sheldon, to the point you're bringing up, what we recommend, what you recommend, the final summation, whatever way, that will be interpreted for the group, right? That will be interpreted to however way it moves forward and what language is used. And then that'll be left up to the voting of the whole group, is what I'm assuming.
Yeah, I think the intent with the form is to make sure we have, like we've had, like there was, similar to last year's report, is comments from the industry, comments from the advocates, comments from the state agency, so that when the report is presented to the legislature, they're very clear on each individual position. That's always the intent with that form.
Ms. Rassicot, regarding last week's meeting, and you might not have this information yet, but there were a couple questions that you said you would follow up with us this week, and I was just curious if you had answers for us, or will you? And specifically, there was a question about how often backup chairs need to be repaired, or how often they would need to be repaired. And the other was about the overnight shipping costs and expedited shipping, how about how much that would cost for
Yeah,
shipping of
the
parts?
expedited shipping, I'm getting that information because I've got to go to all the different manufacturers and how often we're doing it, if it's overseas, how often it's in state. So I got to go, I have 7 different manufacturers. I'm getting that information. So that's being pulled. So I don't have that for today. I knew I wouldn't have it for today so quickly from last week, but I am getting that. So I should have it for next week's meeting. And then the other one for power backup chairs. Well, let's say you got the sister state that's doing that. So depending on how often that's being done, it's a handful at a time. It depends because they just started it. So like in New York, where it was there being done in the boroughs with this one location, it was being done routinely for the power backup chair users that were being done there. In Massachusetts, we probably, depending on how many we've had right now, I can say we're probably doing a couple a week already right now since they incepted the policy of being able to repair a power backup chair. So it's hard to give you exact numbers, but that's what, when I reached out to them to say, no, yeah, we're doing a couple a week right now on a regular basis to maintain.
Is there any criteria around the backup, Diane? Just out of curiosity, because I mean, some of my backups have been to the point where, you know, you got to pay to bring them to the dump. And
Yeah, there's there's like, if it's over $1,000 to repair it, you have to get a prior off, and then they determine if it's, depending on the serial number, we have to give them serial number, see what the age is on it, then they determine yes or no. To that point, Joe, if it's going to be good or not, then they're going to say no, it's too far gone. There's accountability around it by the aging of it. Because as you guys know, your chair is good for 5 years. So once you get past that 5 year or 6 years, sometimes 7, depending on your private insurance, we all know they sometimes try to push it before they replace your chair. With those, depending on how well they were maintained or how well they were to begin with. Typically what we're doing on those though, even for mass health too, though, we're still doing a 20-point inspection on the chair itself to submit that to them so they know just how bad off the backup chair is to begin with for that chair. So they kind of have an idea. And then they're saying, okay, we'll continue to maintain this. If it's over $1,000 though, then we got to get a prior approval and say, is it worth it? Is it not? So if it is in decent enough shape, they're allowing us to go ahead and maintain that for them, and they're keeping that on record.
so it sounds like you got a good plan in place already in Mass.
Yeah, they just started that this past summer.
Thank you, Diane. Mr. Tabman.
Yeah, I just dug up the Massachusetts regs and just so people know what it provides. Besides the prior authorization as mentioned, where the total cost is over 1,000. The member's medical complexity prevents them from being able to use a manual wheelchair or loaner power wheelchair when the primary mobility system needs repair. So just, I mean, that's their regs, their standards for that. And that they, Mass Health will only pay for the repair of one serviceable backup power wheelchair per calendar year, and then documentation. Sounds pretty reasonable.
Okay, thank you. Do we have any other comments? Okay, Diane, were you prepared to talk about last month's data? I know that you shared a little bit about it, but Mr. Slifka and I were talking, and we weren't sure if you wanted to take more time. If that's the case, we would need a motion to add that to the agenda.
I can if you guys want, although we kind of went through the whole thing last week because I kind of laid it up how because I gave you guys feedback on the actual reporting form, because I laid out my report for you guys to kind of give the feedback to the advocacy's report form to kind of help show to you guys to align with it. So unless someone has questions on it from that, or if you guys just want to, for the next meeting, we put that on the agenda and to kind of knock all that out. that's fine. Either way, I'm open. If someone does have more, but we did kind of go through the entire thing. So, we kind of did it by default, and I like it just kind of, and like I said, I gave you guys my comments on the phone, but I kind of shared my report for you guys so you can see how it was answering to the bill's reporting format. This is so you guys can see what I was saying at to my comments that was in your form, to kind of say you may want to relook at that, because I know you guys did a good stab at that, and I wanted to be respectful to what you guys attempted, but make sure this is how we can report back to what's in compliance to the actual report. And then I know myself, my internal IT system is coming back with our new reporting system to align with that next on the 21st is going to be rolling out. So I should be able to pull out another format really easy to mirror exactly how that is. And I just want to make sure, you know, we get feedback from you guys from what I sent over to you. So we make sure if I have to tweak something, IT changes are not easy. So I want to make sure we hit all those points in the format that everyone's in agreement with.
Thank you, Mr. Tubman.
Yeah, what I wanted to propose, Diane, is that rather than taking the time of this committee, I mean, we're having a lot of trouble tracking what we proposed in our form versus your thing. You say it includes, but it's really not, and it's hard to map it. And it doesn't, we know it doesn't include, for example, minimums and maximums, which are required by law. Would it be okay if we communicate with you directly with our questions and concerns instead of taking the time of the whole committee? Because I'm guessing, I don't want to speak for anybody at all, but I'm guessing that if the industry and the advocates agree that this X form is, you know, the way to go and will be uniform between the two providers, that nobody else is going to object. I mean, we could always present it to the whole group, of course, but I'm just wondering whether it might be more efficient to just do that.
Yeah, I have no problem, Sheldon, if you want to send to us directly what, you know, what you thinking the interpretation is of that. So like the problem that we're dealing with and what was shared before, like for my company, we had stuff already developed because of another agreement we have on the West Coast. So we have service levels agreements that are set up with a Kaiser plan that we're able to build into what we call Power BI. So you see like that chart that I showed you guys, that's built off of calendar days, right? Although the bill is built off of business days and there's some things that we got to count and we got to kind of count that in. So what we're doing right now is a manual process for the reporting. What I have being built right now for like the min, max, and average that you're looking at are some things, and then some parts of it's percentages, you know, is it a in home? Is it in the facility? Is it remote? Is it, you know, all the parts that you have on there? So there's two components of it. That's what kind of like I was trying to lay out the form on. Those we should be able to do that for you. And that's kind of like what I'm telling my IT department's building right now to make it for that format. And I have a meeting tomorrow to make sure the reporting's mirroring what's in the bill language to like the min max average that you're talking about, and then looking at each one. So if you and I and if Maureen or Jonathan needs to get on a call together to look at some other things offline, if the committee has no problem with that, I have no problem with that. And then if we need to do like a working session of something of that nature, just for time compliance, I have no issue with that. We can work that. We'll make sure we get to that point where everyone feels comfortable, and work at that if that's everyone's in agreement with that. Because there's no reason to take everybody's time up either on this to need it up or something for a formatting, right? I don't think that's the intent of this group, is to waste time on that. It's a matter of, is the bill going in the direction it's supposed to, and then coming up with where we're at with that. So I have no problem doing that.
Thank you.
Yep.
Okay, seeing we have no further agenda items, I'll take a motion to adjourn.
one follow-up on,
Oh, sure.
the meeting for next week. As I understand, you're going to send out a doodle. Is there, before, before you do that to save time, are there days that it can't be? I mean, like that are just so we know what the universe is?
As it stands right now, the doodle poll will be Tuesday through Thursday. Monday is not we don't want to do Monday because it's too quick. And Friday, we don't have availability on our side. So right now it's going to be Tuesday, somewhere between Tuesday and through Thursday.
The same time frame? Same
Yes.
time window?
Yes.
Okay.
And I think that would be Zoom only.
Zoom only, yeah.
Thanks.
Do I have a motion to adjourn?
Motion.
Thank you. Second.
I'll second.
Michelle seconded.
Oh, thank you. Can't see. All in favor?
Aye.
Opposed? Hey, we will get back to you with the date of our next meeting and also with the notes about the recommendation.